Hello, good morning, good afternoon. My name is Gerald, and I did my project about incorporating mandatory patient follow-up to prevent readmissions 30 days post-discharge. I did this project because I work in a med-surg unit, and we experience lots of readmissions after we discharge our patients. Some come 10 days, 30 days, or some even come 2 days after discharge. And when you look at the problems or the reasons why the patients are coming back, you find out that we can avoid some of those problems if you have a good plan, like some kind of follow-up care on the patients once they go home to make sure that they are following up with the plan of care after discharge. They are going to the pharmacy to take their medications the way they're supposed to. They are making follow-up care with their primary care providers, and if it's rehab, they are going to do rehab like they're supposed to do. My project is going to flow from an introduction to rationale, to background, to problem statement, literature review, proposed plan, implementation, evaluation, dissemination, and summary of the project. For my introduction, I said that frequent hospital readmissions are preventable through discharge planning, inpatient education, and a close patient follow-up post-discharge. What means this means is that if you could have like a good plan of these patients when they are still at the hospital, like from admission, we start planning for their discharge. We educate them, we talk to them, and tell them about our expectations once they go home. Then we're gonna have a nurse over there whose job is to make this follow up with the patients once they go home. Maybe they're gonna make a telephone call, talk to them, make sure they went to the pharmacy, got their meds, make sure this patient is making a follow up with the primary care provider, do what they're supposed to. If it's outpatient rehab, make sure this patient is going to do those PT or T therapy like they are supposed to do. The rationale for my project is that hospitals and other healthcare providing facilities experience a very negative impact from high readmission rates. This means that if patients keep on going and coming back, going, coming back, that is it's not gonna appear very nice or very good to the hospital, and patients will not be willing to come back, or new clients will not be willing to come to a hospital where people keep on going and coming back. Uh, Readmissions also increases the patient chances of advanced events and reinfections. What this means is that if these patients keep on coming back at the hospital, most probably they might get some hospital-acquired pneumonia, they might fall, might get some UTIs, and if they fall, that or get some kind of infection at the hospital, it's more stressful to the patient and also to the staff who are working there. These frequent readmissions also are very costly to the health organization financially because most insurances and other like Medicare and all that will not reimburse the hospital if the patient comes back within a certain range of time, like even these 30 days or 20 days. The hospital will have to put that bill in a way or another, which might be very costly. Paying employees, paying for the care of the patient, medications, and everything. So it's very costly to the organization. And on the background, I said frequent readmission is considered a poor mark of poor quality of care because like they keep on going, coming back, going, coming back. That means something's not right in the hospital or that facility. So it's a mark of poor quality of care to our patients. Readmissions also constitute a substantial proportion of avoidable healthcare expenditure. Yeah, if they keep on coming back, you keep on spending money on them, and that money can be used to maybe get new clients, maybe increase pay for the staff, or maybe do something good for the organization. And also, healthcare organizations strive to reduce readmission rates through targeted readmission prevention programs, including discharge planning coupled with some post-discharge follow-up, which have reported promising results. Evidence has it that making good follow-up to these patients, making sure they are doing what they're supposed to do when they go home, it reduces the chances of them coming back, and by the end of the day, the quality of care will be good. On my problem statement, I said in medical surgical patients, how does incorporating mandatory follow-up interventions post-discharge compared to standard discharge instructions affect the prevalence of the admissions? Okay, for my literature review, the main literature review was conducted utilizing common and CINO databases at the Midwestern State University online library. Journal articles and peer-reviewed papers were analyzed for this project. And in most of the articles, we find that post-care interventions are associated with significantly lower rate of 30-day hospital readmissions. Like on one paper, I found that when we do like some interventions, the chances are 8.79 versus 13.94 if we don't do anything. And also, according to this another article by Finlayson, acute hospital services account for the largest proportion of healthcare system budget, and patients who have been recently discharged from the hospital may be at a greater risk of readmission back to the hospital. That article also found out that where attempts have been made to contact a patient for post-discharge, the rates of admissions was lower. It was 9.24 compared to 15.7, where there's no attempt to follow up that patient and see how they are doing and all that kind of stuff. Also another document, another paper also found that to reduce and plan 30-day admission more effectively, discharge planning should include post-discharge services to address healthcare conditions beyond the primary cause of initial hospitalization. Like we should plan when they go home what you're gonna do and to make sure that they are following up with the care. And all this planning and follow-up services serves as an innovative model that healthcare systems can replicate to improve transitions of care for complex patients. Also, in another study, we found that it is imperative that healthcare organizations try to reduce admission rates and reports that readmission prevention programs, including discharge planning coupled with post-discharge follow-up, have reported promising results benefiting both the patient and the organization. So, for the proposal of my project, I propose the creation of a post-discharge nurse position with acute care experience, like a nurse from med-surg or a nurse from ICU or a nurse from the ear. They can be tasked with that job of making follow-up care with our patients to make sure when these patients go home, they are doing what they're supposed to do. They're following up with their care providers. They're taking their medications, which is supposed to, and all that. I also found out that incorporating a comprehensive care approach involving the patient, caregiver education, well-being promotion, as well as complexity management and promotion of continuity of care have been identified as hallmarks of high-quality traditional care. And according to Vernon, there is a promising evidence that a telephone call following discharge reduces the chances of readmission by half to 50% compared to a no call. And according to Bresco, with increased nursing experience, skills, supporting patients and making patients care more team-based and planned, educating patients positions have shown the greatest improvements in overall health outcomes. And also, follow-up care is recognized in the National Institute for Healthcare and Excellence guidance, which recommends that patients with social care needs who are at risk of readmission receive follow-up phone call or visit from either a nurse or a general practitioner 20 to 24 to 72 hours after discharge. And on my implementation, we can implement this project in our medical surgical unit, as a year dependent, outpatient clinics, and any other healthcare providing facilities to improve patient health outcome post discharge. And a BSN trained nurse should be tasked with follow-up care interventions post discharge because I believe and as through the decent program and all that, they have some good knowledge on what they're supposed to do in the importance of making those follow-up care to our patients and making sure that they do what they're supposed to do after they go home. Then on evaluation, I say evaluation of readmission rates post-discharge after implementation of the proposed project. Like after we implement this project, we're gonna go back and evaluate how are we getting more admissions after the project, or is it the same, or what do we need to do better, and all that kind of stuff. It's like a learning process. And we're also going to evaluate the organization expenses on admissions post implementation of the project to see whether our organization is saving some money or what's going on. You can also send surveys to our patients' positions and inquire about follow-up care and patient satisfaction. You can also get some feedback from our staff and ask them, hey, how's the project? What do you think about our new project on making follow-up care with our patients when they go home? Is it working good? Or what they think, and get some more feedback from them. On the dissemination part, we can do this through in-service training to medical, surgical, ER, and outpatient clinic nurses monthly and during hire. Every month, we're gonna have an in-service about follow-up care and all that. Then during hire, we're gonna let the nurses know this is what you do to a patient. They go home, make a follow-up, and make sure that they're doing what they're supposed to do. You can also print some pamphlets with discharge guidance on what you're going to do when giving to the patients during discharge, explaining to them we're going to make a follow-up with you, and these are the expectations when you go home, and these are the reasons why we are doing what we're doing. You can then you can do some presentations during professional nursing conferences, like when there's some kind of conferences for nursing. This project can be disseminated over there. Then on my summary, I say that the admission for discharge is preventable through effective inpatient education, discharge planning, and a close patient follow-up post discharge. Readmissions post discharge are often considered a poor mark of quality of care, and planned post discharge care are shown to reduce frequent readmissions. Discharge planning should start from admission, considering patient diagnosis and the ability to follow up with care after discharge, and do what they're supposed to do when they go home. All right, thank you.